My name is Dr. Sujith Vasudevan. I am a consultant physician practicing in Ernakulam in Kerala, India. And over the next 20 minutes or so, I will be sharing with you very randomly some of my thoughts about my medical practice, in which I have been there for the last 35 odd years. My father was a doctor, and in those days, naturally, the pressure was on you that you must follow in your parents' footsteps. And thereby, while initially I was not very inclined to be a doctor, thanks to my father's friends, some of my relatives, I became a doctor. I qualified from the Kasturba Medical College at Manipal, and I am forever grateful to the teachers there and at the KMC Mangalore for making me today what I am. I started practicing in the private sector in 1979. I had my own nursing home, as we used to call it, which I shut down 10 years ago due to various reasons, and now I am a pure consultant having a clinic which we run from about 7 in the morning till 7 in the evening. I am assisted by my wife, who is also a doctor. Over 35 years, there has been a sea change in the way medical profession is practiced and perceived. There are several reasons for this. Many good things have happened to medicine. Many innovations, many inventions, many new tests, a lot of advancement in treatment modalities or therapeutics, advances in surgery, and so on and so forth. While a lot of this has been good for the medical profession as well as for the patient population, a lot of changes have taken place which in my mind have not been really excellent for what we term as the doctor-patient relationship. I remember way back in 1979 when I started practice, there were not many large hospitals here in Ernakulam. There were certainly no corporate hospitals. They were small clinics and nursing homes, general practitioners, what were called as family practitioners or family doctors. My father was a classic general practitioner. He was available 24 hours a day for his patients at the peak of his practice, of course, not as he aged. And he was very much a family member for most of his patients. You know, he knew all his patients by names. He knew the family of the patients. He knew the history, sometimes the birthdays. He used to be with them in happiness and in grief. He used to do house calls. My father could walk into any of the homes of any of his patients and ask for a cup of coffee or a biryani. There was also some kind of a barter system in those days. I would be amazed as a student in school when we used to get sacks of rice, banana bunches, vegetables, fruits, fish, live ducks, all brought by patients in exchange for the medical services which my father used to give them. All these are things of the past, because probably we have grown up from something more than a village to a large modern city. So whilst many good modern things are available, I certainly miss some of the what you call the human aspects of medical practice, what was then. I remember my mother getting very upset one day when my dad sent home from his clinic a fish, if I recall it was a tirida fish, which is about 3 feet long and alive. And she was wondering what she would do with it. And well, those are the things those days. The other thing that has changed when we look at the perception that patients have of doctors, whether it is good or bad I cannot comment on, was that there was a kind of blind faith. He literally, the patient, he or she, literally put his life in your hands. And what you said as a doctor was the gospel truth. Even I experienced that when I first started practicing here. And I was amazed that a person could have so much faith, so much of trust, trusting his life, the life of his near and dear to somebody whom he knew for maybe a few months or maybe was meeting for the first time. There were times, in the olden days, for instance, treatment of typhoid. And we had none of the new third generation cephalosporins or azithromycin, which we have now. We were restricted to chloramphenicol and a little later with cotrimoxazole. And we used to tell our patients, listen, you have to lie down in bed for 2 weeks, take this medicine, have kanji or rice gruel, and your fever will last for another 10 days. You may get complications in between. And they used to believe you and they used to follow your instructions explicitly. But today, things have changed. The people's anticipation of medical services is extremely high, very often unrealistic. I had a patient who came to me, he said, I've got a fever, and I just asked him to take off his shirt, and there, what was staring at me was chicken pox. The vesicles, the pustules of chicken pox, may not be pustules, vesicles of chicken pox. And I told him, listen, you got chicken pox, and of course it is only the first day. We can give you some medicines to reduce or try to reduce the severity of the illness. You are an adult, but you will have to maybe take rest for an isolation for a week. He said, that is ridiculous, that's impossible. I have to go to Singapore day after tomorrow. You must make me all right by then. So see the difference in the years that has gone by, that even though education has, or medical knowledge has disseminated down the line to the patient, his expectations are sometimes very unrealistic. And this is what we find as a very great difference, because people want things to happen in a hurry. And that sometimes creates a lot of problems for us doctors. I have noticed for one thing is that, I jokingly, only half jokingly say that patients come to us not with symptoms, but they come with diagnosis. A patient comes and tells me, doctor, I have been having sinusitis for 1 week. He will never say, I have had a cold for 1 week. He'll come and tell me, oh, I've got severe tonsillitis. He will never say, I have a sore throat. Or he will say, 2 days since I have this viral fever. I was in 1996 on a Rotary program in the United Kingdom, and we were staying with hosts. And there was one place which was left vacant at the dinner table. So I asked them, who was supposed to be there? He said, it's my son John. This is an Englishman, mind you. And I said, oh, where is he? Is he not here? He said, no, he's not well, he's sick. So being a doctor, my curiosity was evoked. And so I asked him, what's wrong with him? He said, he's got a fever. So I said, what did the doctor say about the fever? He said, oh, he's had fever only for 2 days. We have not taken him to a doctor. If we take him to a doctor, doctor will give him paracetamol or aspirin. We'll wait for another couple of days, and if the fever doesn't subside, then we take him to the doctor. Now, this is in a first world country. Now, we transpose the same sort of situation into Kerala. I get a boy one day about 16 years old who works as a waiter in a restaurant in a small tourist hotel nearby. He comes and tells me that, I've got, in Malayalam of course, he says I got very severe fever with very severe body pain and very severe back pain and severe weakness. And he asked me, is this rat fever or is this Wales disease? So I asked him, how long have you had the fever? He says 2 hours. So in 2 hours, he expects me, by listening to the history, to make a diagnosis, which is, ridiculously impossible. We also have this case where people come with fevers on the first day. Now, any doctor will tell you it is almost impossible to diagnose a fever on the first day. And it's always better to under-treat a fever than over-treat a fever. You may land up with problems if you give an antibiotic without knowing whether the patient really requires an antibiotic. It is excellent that we have technological advancements, in the terms of diagnosis. Like when I started a medical practice way back in 1979, ultrasound scan of the abdomen, CT scan of brain were just sort of so nascent and just blossoming, coming out of the ground, so as to say. Now you have scan centers at every nook and corner, every hospital, with newer and newer types of CT scans, MRI scans, PET scans, and so on and so forth, and patients are very aware of it. When you have been in practice for so long a period as I have been, it is inevitable that you interact with people over a long period of time. There are some who become very attached to you, some who become very, maybe the word is not correct, faithful to you, and would not dream of doing anything without consulting you first. And that is where the role of a primary care physician is. Over the years, there have been dozens of patients, some of whom are not with us anymore. I've been asked to recall a couple of interesting patients who I remember. There's my mentor and friend and guide here in Cochin, VCG, who I consult on everything that I need to do from a financial or developmental point of view. I've been looking after him for about 30 years over here, and I recall one day he came with a mild abdominal discomfort and loose motions and a little fever, which we thought was a food poisoning, and treated him, and over a period of time it became very, very critical. In just a matter of a couple of days, the pain became very severe, and then he had a perforated diverticulitis, which we fortunately managed to get him to hospital on time. He underwent surgery, and probably because I was a primary physician, I could coordinate with him, for him, with the gastroenterologist, with the surgical gastroenterologist, and due to the availability of all these gastric specialties, we could get him out without any complication. He continues to be my patient today, continues to be a well-wisher, and this is just one of the instances of where, while as a primary physician you are not able to treat everybody, you can help in coordinating the management of these patients. And as a primary care physician, you keep in touch with the other specialties. You are able to contact them instantaneously and get a feedback. I would again like to give an instance of a good friend, an old classmate from school, Mr. Ali, who came to me one morning. He said vague discomfort in the chest, and he was looking uncomfortable. He was sweating a lot, and we took an ECG for him, and the ECG showed that he had an extensive anterior wall myocardial infarction, a heart attack. Probably in the olden days, we would have admitted him and then given him some clot dissolving medicines, but with the availability in many hospitals of what is called as primary angioplasty, I called up the cardiologist of the nearest big hospital and rushed him there. He underwent an immediate procedure called as an angiogram, which showed a very large block, and he underwent an angioplasty. Initially he was recovering well, but later on he developed renal problems. And at one point in time, his kidney failure was so bad that he was almost given up for dead. I recall that I was going abroad for a few days for a conference, and he was just hanging in there, and almost everybody had washed his hands off. I went and met his wife, and I commiserated with her, and I said, I'm very sorry about this, but I have to go. When I came back after 5 days, surprisingly, he was making a recovery. And he made a full recovery, came back with normal cardiac functions, normal renal functions. And though I cannot claim that I did anything with it, but I think it was a coordination of many specialities, the understanding that you have between many doctors that enabled him to clear all those hurdles and come back to a normal life.
Dr. Sujith Vasudevan is a good friend of mine, my childhood friend. We grew up together in Cochin. Later, when he became a doctor, he was our family doctor. He treated me, he treats my children, he treats my wife, he treats everybody. When I had a heart problem 4 years back, I went to him and he actually saved my life. He didn't waste time taking ECG and things like that. So because I was able to reach the hospital in time, I was able to survive. As soon as we reached the hospital, I was subject to angioplast. After the angioplast, I had what is called a septicemia. The whole process became septic, and I was put in a ventilator, and I was in a ventilator for 3 or 4 days, and everybody has written me off. During all these processes, it was Dr. Sujith who was supervising, even though it was a private hospital. Dr. Sujith, as a friend, was supervising all my treatment there at the hospital. He directed the doctors there what is to be done, and fortunately I was able to survive the septicemia because of the care and the help that I was received from all my friends.
Probably I can sit and think and give you dozens of interesting episodes of, doctor's profession is not always unhappy and sad. Sometimes there are very bright and nice moments of elation where you feel extremely happy doing what you are doing. Sometimes you get a lot of laughter also in medicine. I give talks on what I call humor in medicine, and people ask me what is so funny about medicine. It's not funny. I think all of us, we deal with serious patients, we deal with disease, we deal with death. I think it's essential that we keep a sense of humor with us all the time we go. I keep my ears wide open because, like I said earlier, patients do read up. That's another thing which happens. People read up from books, from magazines, and increasingly from the internet about their disease or what they think is their disease, and so they come with diagnosis. And sometimes you get people making extremely funny statements. One of my patients called me up and said, "Doctor, I think what you said was correct. My wife's diabetism is very severe. She will require your hospitality and will have to be insulated." Of course, that meant he felt that she will have to be hospitalized and require insulin. So these are all, in this little brief time, some of my experiences and my thoughts, extremely random, about my practice in which I have been for 35 years. Doctors are not supposed to retire, not in this country anyway. You practice till you can practice, until health issues or death makes you stop it. I have been extremely fortunate in having a very understanding family. My wife is a doctor and she works with me. She's a qualified gynecologist, but she sacrificed her profession to assist me, look after the administration, initially of the nursing home and now the clinic, because we do a lot of work for insurance and for corporates. Does require a lot of paperwork. I have 2 children. Both of had a very clear idea when they were about 8 or 9 years old. You ask them, what do you want to become? What do you want to do? They say anything but medicine. Probably when we were raising our children at a very young age, when I became a father, I was 23, my wife was 22. And we started practicing when I was about 27 and she was 26. And in the first few years, you concentrate on your practice. This is when the children grew up. And we had no Sundays, we had no vacations, we had no cinemas, we had no picnics, we had no visits to the zoo. Children saw that we were not available for them most of the time. So I think when the time came to realize, what do you want to be? They said, anything but a doctor. My son has done his MBA and he works with Visa cards as a country manager, fraud detection and prevention. My daughter has done her media studies and she's into client relationship with a company here in Cochin. I have no regrets for this. I think the time that in the late 60s, when we were on the threshold of a profession, the options available to us were very few. You could be a doctor, you could be a lawyer, you could be a chartered accountant, you could join the army. Beyond that, very few that I can think of. When I look around and see ask somebody today, what are you doing? And he gives me a profession which I don't even understand. The options are much, much more. Medical practice probably also has come to that stage where there are so many options. When we did our MBBS, many people stopped at MBBS and turned to general practice or work in hospital as casualty medical officers. Some, a small percentage did MD or MS. A still smaller percentage did DM or MCH or went abroad and did MRCP or FRCS. But today there is a tendency that nobody wants to stop at MBBS. People do MD, DIP NB, MNA, MS, go abroad, take degrees, take specialization. So actually it's a question of knowing more and more about less and less. In the twilight of my practice, do I have any regrets? None that I can think of offhand. If I had a chance to do it all over again, would I do it? Probably yes, but with some differences. Differences in this way that, I have always been a solo practitioner. I would have gone into group practice, which I know is not very common here, but is very common in many parts of the world, where 3 or 4 doctors join and do a similar practice. So 1 or 2 doctors would be able to take time off to travel, to be with their families. My initial years were quite tough on me, very tough on the family because of the points which I already mentioned. So that's one change probably I would make. But I have thoroughly enjoyed my profession. I consider myself a people person, and I love my patients. I get along with them very well. I wish I had some of the qualities of my father or the time of my father, where you had a much more meaningful and deep relationship with your patients. But as times change, people change. Maybe I have also changed, I do not know.